Muy buenos días a todos. Esta presentación es capítulo 1, capítulo 2 es en la tarde. En esta presentación voy a hablar en inglés y la segunda será en castellano. Bueno, so what I'd like to talk about is some of the evidence for promoting physical activity and increasing population levels of physical activity. What we've seen in the previous presentation is how important physical activity can be both to health and to energy balance. And this presentation and the following one in the afternoon are largely drawn from a paper that our group published earlier this year, which you can see here. And these presentations address the questions that you see here. We know that physical activity is important to health. We have a pretty good idea of how to increase it in small groups or even modest-sized communities, but we have a very difficult time making this what those of us who work in this field think it should be, a national priority, and it seems to be quite difficult to demonstrate that we can increase physical activity levels across entire populations in a country or a large part of a country. However, we live in a large world, and there are some countries which have done a better job of this than others. And what I'd like to do in this first presentation is lay out some of the overall evidence of what seem to be the most effective ways of increasing physical activity, and to reflect on the examples from two countries which have done quite well in this regard, Canada and Finland. I'll say a little bit about Brazil and Colombia, and then in the afternoon I'll concentrate more on what seems to have worked well in Brazil and Colombia. Excuse me. Much of this field has recently been summarized in a series of papers published in 2012 in The Lancet, and I refer you to that as a good example of the overall evidence supporting physical activity. And one of the things that we've seen in this Lancet series is the scale of the problem that we have around the world. And so I'll show just a couple of slides to reinforce this. We now have pretty good data on physical activity, self-reported physical activity, from two types of questionnaires, the International Physical Activity Questionnaire and the Global Physical Activity Questionnaire, each of which has been used in approximately 100 countries around the world. And between the two of them, we have data for well over 100 countries that account for about 90% of the world's population. So we have a fair idea of what activity levels are like around the world. Now, as you saw in the previous presentation, to really understand this, we would like to have more objective measures of physical activity. And unfortunately, this data is self-report, but it gives us a rough idea of the situation around the world. And in fact, if we look at this chart, we see the data for men and women, 15 and older. The darker colors, the reds, indicate prevalences of inactivity approaching and above 50%, and the lighter colors reflect lower prevalences. White indicates no data. First, you can see that we have data from quite a few places. The second thing you'll notice is that there's an unfortunate amount of dark red in Latin America, that in fact countries in Latin America are amongst those that are quite inactive. Overall in the world, 31% of adults fail to meet the physical activity recommendation that's common to the World Health Organization, the United States, and many other countries, of 150 minutes of moderate or vigorous physical activity every week. So we have a population level problem. And in fact, that problem is a significant one across most countries in the Americas, a little more so for women than men, but we have somewhere between a third and half of our adult populations that do not get sufficient physical activity. So as a public health physician, I see this and I say, well, this is a population-based problem. We need solutions not just at the individual level, but clearly at the level of countries, regions, and the overall population. Okay. The situation is actually, while I won't focus as much on adolescents, is acute in adolescents as well. You see here that 80% of adolescents around the world don't meet the World Health Organization recommendation for physical activity amongst children and adolescents. And you might say, excuse me. Surely children and adolescents are more physically active than adults, and you would be right in that assertion. However, the recommendation for children and adults is substantially more. It's 1 hour a day instead of the 150 minutes a week, which is roughly 30 minutes a day. So, but it would appear that we have a looming problem in the next generation with a large group of adolescents failing to meet physical activity recommendations. So just how big of a health problem is this? Aimin Lee from Harvard did a very nice job of summarizing the proportion of mortality around the world that we can attribute to physical inactivity by looking specifically at the major chronic diseases for which physical inactivity is a risk factor: coronary heart disease, type 2 diabetes, and breast and colon cancer. And if you look across these diseases and also at all-cause mortality, physical inactivity accounts for about 9% of total global mortality. And you can, this is a population attributable fraction approach. This gives us a rough idea, and it's useful to look at this in comparison with other important causes of mortality. Two that we're especially interested in here at SLAN and the fields we work in chronic disease prevention would also be smoking, consumption of tobacco, and obesity. And you can see that physical inactivity causes a similar proportion of global mortality as both obesity and tobacco control. Actually, Francesco Branca presented more updated numbers for obesity last night, so that could actually be somewhere between 3 and the more recent data suggests 4 million deaths a year. So I think the takeaway picture from a public health standpoint is that inactivity, obesity, and tobacco are roughly comparable as scourges of global public health, causing 4 to 5 million deaths every year of the 50-some million deaths that we have each year around the world. So these really demand our attention from a public health standpoint. So you say, well, do we have evidence that we can do anything about physical inactivity? Can we increase levels of physical activity at the individual level and at community level? And in fact, there is also good evidence published in the Lancet as well in this regard. And in order to generate the paper published in the Lancet, Olga Lucia Sarmiento at Los Andes University and her group led a review of the 100 reviews of physical activity interventions which had been published between 2000 and 2011. And you see a summary of the topics covered here. You can see that in fact there is a large body of evidence disproportionately from high-income countries, excuse me, and probably leaving out some areas that we would really like better evidence on. I think especially technology, really the cutting edge of physical activity promotion in many ways, but also an area that it turns out is especially important in the Americas, and that's physical activity related to transport, not just activity in leisure time or activity on the job. So we know quite a bit about promoting physical activity, although there are still some significant gaps. This slide is a little bit difficult to read probably from your distance. It looks at the effect sizes for increasing physical activity across 14 different types of interventions. And the takeaway message on this is that we're able to increase physical activity levels with a wide variety of strategies across a wide variety of settings. However, none of them is spectacularly effective. All of them increase activity levels a little bit. And I think this is actually a rather important message from a public health standpoint, in that if we want to increase population levels of physical activity, one size will not fit all. We need strategies in schools, we need strategies in community centers, we need some that focus on technology, some that focus on transportation, some that are embedded within the primary care systems. Increasing physical activity is difficult, and different people will respond in different ways. Different communities will have different patterns that suggest a different menu of intervention strategies. Another way to summarize this evidence, and this has been used for the community guide approach in the United States, the National Institute for Clinical Effectiveness in the United Kingdom, and more recently in the GIA project in Latin America, and then also for the Lancet series, is to look across broad categories of physical activity promotion, and you see those on the left on this slide. So informational strategies, behavior and social change strategies, and then the third group, environmental and policy changes. And then within each of these broad approaches, there are a number of different strategies, which you see summarized in the center, and the quality of evidence for them varies. And again, this reinforces the point we've had previously, that there's a substantial body of evidence today on promoting physical activity, and that the quality of that evidence differs. So for example, in some areas that have been studied fairly intensively, such as school physical education, is really quite good. If we use evidence-based strategies and can implement them effectively in schools, we can get children to be more physically active. In other areas, we're still on the cutting edge. We are convinced from cross-sectional studies that changing the structure of communities, more parks, more green space, better integration of walking and cycling for transportation with mass transit will increase physical activity levels, but the evidence is really still accumulating there because these are difficult studies to carry out. It can be useful to superimpose these intervention strategies on what is now a widely used schema for changing health behaviors. That's a socioecologic model. And the point here is that we have some strategies which focus on the interpersonal level, other on the interpersonal level, others that are more at the community level, and others are very broad at a high policy level. This is true for diet and nutrition, just as it is true for physical activity. And a couple of decades ago, most of our work was very much focused at the individual level, so at the lower part of this graphic. Today, we realize that whether it's national dietary guidelines or food supply, or whether it's the environment and policies that influence physical activity, much of the change that we would like to see happen is guided by the physical and the policy environment. And we need a much broader view of our strategies. So, how are we doing around the world in taking a broad approach to physical activity promotion? What I'd like to do now is look at a couple of countries which have a long history of trying to take a broad approach to physical activity promotion. And I'll start with Canada and Finland, say a little bit about Brazil and Colombia here, and come back to them this afternoon. So, and we're sort of starting from the north of the Americas and working our way to the south. So Canada was one of the first countries which looked at physical activity, fitness as national priorities. And some of this was initiated when in the 1960s, public health professionals in Canada and sports and recreation people were looking at early work done in Scandinavia, which was one of the regions of the world which first took this issue on, and comparing the situation in Norway and Finland and Sweden and Denmark with that in Canada. And one of the observations they made was that the typical fitness level of a 60-year-old Scandinavian was about the same as a 30-year-old Canadian. And this was somewhat concerning, obviously, and was used very effectively to mount a series of promotional efforts with an NGO in Canada called Participaction. And Participaction began in the 1970s with a number of campaigns, really public health campaigns promoting physical activity and exercise, beginning in the 70s, based on some of this initial work that was done in the early 60s that was very focused on sport. And most Canadians, as you can see, 70 to 85% of Canadians are actually aware of Participaction. As in all public health efforts, the funding has gone up and down, the politics have changed over time, but Participaction has been a common feature of the public health and the physical activity promotion environment in Canada for more than 4 decades. And I think this is a really important message, that changing physical activity levels at the level of a country is not something that's done with a brief campaign, a burst of energy and activity. You have to be in this for the long haul, and Canada is a very good example of this. The second feature of the programs in Canada, and you'll see this is a common theme that we see in Colombia and Brazil and Finland as well, is that while there was a broad national effort to focus attention, increase knowledge about physical activity, and really create a positive policy environment, the real action was at the level of communities. Canada is really a federal system where the provinces, the equivalent to states in many countries, have a lot of authority and a lot of ability to generate programs. And much of the work in Canada really took place at the provincial level and the municipal level. And again, the funding was up and down, but over a series of several decades, there was consistent funding at the provincial level for physical activity promotion. The other area of innovation in Canada, and this is one where today nobody is going to be surprised that we have a focus on lifestyle physical activity. Physical activity in the neighborhood, walking, more than just sports and exercise. The Canadians began to look at this as a key to getting more people to be active in the mid-1980s. And then really this was one of the first countries that put a major emphasis on not just sports and exercise, but physical activity as part of daily life as well. So you can say, well, Canada is a good case. They're an example of success, and in fact, their physical activity levels have increased over time from around 40%, 30 to 40% of adults meeting physical activity recommendations to somewhere around half of adults. So a pretty substantial population level change. So, however, we wouldn't know that if Canada wasn't also on the front lines of having good public health surveillance. So the Canadian Lifestyle and Fitness Institute, it's very good work by Cora Craig and colleagues, over the decades has done a pretty good job of measuring physical activity. So Canada is one of the rare instances of a country in which we have a lot of action over several decades, and we have public health surveillance that has given us a sense of what's going on. The other place where we've seen a very similar story is Finland, and I'll summarize Finland briefly. This is going to look an awful lot like Canada to you. Multi-sectoral national policies for promoting physical activity starting in the 70s, gradually being updated until actually very recently. There's a big push last year to focus on physical activity as well in Finland. Multiple national initiatives over time, giving a broad national infrastructure, but the real action has been at the local level, where the Finns are remarkably good is at providing local infrastructure for physical activity. Finland's a country of only 5 or 6 million people, and you can see they have created 30,000 sites for physical activity in the country. So roughly for every 200 people in the country, there's a facility, whether it's a field or a path or a community center for physical activity. And again, the Finns have had good national surveillance, much of this going back to their early efforts in cardiovascular disease prevention, and have been able to track physical activity increasing recreational and a little bit occupational transportation activity from the 70s to 2000. So I'm going to come back to Brazil in the afternoon. I'll give a sneak preview of what I think have been some of the key efforts in Brazil. And obviously Brazil is a much larger and more complicated country, more diverse in many ways, especially socioeconomically, than Canada or Finland. And efforts in Brazil have been especially focused on making physical activity available across the spectrum of neighborhoods to poor as well as rich, and using free community-based physical activity classes as part of a strategy to get more people active. And I'll talk about that this afternoon. The other thing I'll focus on is some of the efforts in Colombia. Many people are aware of the ciclovia, especially in Bogota in Colombia, which has been, since the 1970s, has become a very strong part of a culture of lifestyle in Bogota. There have been many other aspects as well, and the ciclovias have expanded from initially just a few large cities, especially Bogota, also Medellin and Cali, to now a network across 70 cities in Colombia. The ciclovias are interesting both because of the scale, but if you look on this corner of the slide, also because they capture the full breadth of the population. These are not just programs for people who like to wear Lycra and ride their bicycles very fast. These are programs that get real people from all the neighborhoods across the city out and on the streets and more active. And I'll come back and talk about that in more detail this afternoon. So to sum up, what are the characteristics that are associated with taking the evidence we have for physical activity promotion from research studies, which tend to be at individual level or small groups, and applying them at the level of an entire country? This is work in progress. You can say this is a series of case studies. If we were working at individuals, we'd say we're nowhere near the type of evidence we would like to have to build a case for global physical activity promotion, but there are suggestions that the factors that you see here are associated with success. Public policy is critical. You can't do things at a broad public health scale without good public policies. But the real action seems to take place at the level of communities. That's where people live. That's where they make changes in their health behaviors. Public space and facilities for physical activity are really critical if we want to get a lot of people more active. And issues of equity are important. And these really play out, especially in the programs in Brazil and Colombia. Most of the programs that seem to have the biggest potential for changing population levels of physical activity are outside of medicine and public health. Not entirely. The primary care sector is critical. John is going to be talking about that. But changing the structure of communities, getting more park space, making our streets safer are not things that we normally work on in public health. This doesn't happen without ongoing investment from national and regional governments, and this clearly makes the case that advocacy is important as well as evidence. And we really know what's gone on in the handful of countries I've focused on, in part because there's good public health surveillance for many decades in Canada and Finland, and in the last decade or so in Brazil and Colombia. And finally, physical activity is part of culture. And if we want to make people more active, we need to understand the cultural issues and find ways that are consistent within the culture of every country to get people more active. So, thank you for your attention. Y en la tarde vamos a esta playa en Brasil y vamos a discutir un poco más sobre promoción de actividad física en las Américas. So, gracias para su atención.